Okay, so we're going to begin our first lecture on the integumentary system. You'll kind of see me, I have a couple bullet points and notes in the book with highlights and all that. So I'll kind of be looking around just a little bit to make sure that I get the points as I mentioned in the orientation, because this is how I'm going to be constructing your quizzes, your tests, so that they go together and as they should, in my opinion. And as I had said earlier, of course, please read the entire chapters. It's not that I don't think anything is not important, but I'm just focusing on certain things that I think, and I think as I'm going through, you'll kind of see where I'm going. So for this particular chapter, which is chapter 53, which is entitled Integumentary System Function Assessment and Therapeutic Measures. So I think a lot of the time when we think of integ or integumentary, and even myself, I always think of the skin. So keep that in mind that it's not just the skin that constructs of the integumentary system. There are actually several different components, because obviously the skin can't stay alive without blood vessels, right? We have glands. Some other things I wanted to mention was your hair, your nails. Those are all components that make up actually the integumentary system. So you have the integumentary system, which is obviously everything that I just said. Most of you do know that your skin is your largest organ in your body, or not in, but on your outer part of your body. So with that just being said, I can imagine how, I mean, obviously all of our organs are important, and some we can't live without, some we can. Your skin is very important. It's a huge part of your body that it's protecting you from the outer world. And I really want to stress the fact that what is normal versus what is not. So as I said in the orientation, as nurses, no matter where you work, we want to know, okay, yes, I work, let's say in a pediatric clinic, for example, and I'm usually there doing immunizations and, vital signs, and that's my job as an LVN, and it's great. I love it. You get to talk with the kids, but mom, may mention, oh, there's this rash right here, this, that, the other. Are you able to assess it? What are the terms that you're going to use to speak to the physician? Do you know what a certain word means? So why I'm mentioning that, number one, you always want to know abnormal from normal. Obviously, we know a rash is not normal. More than likely, it's very rare that it's going to be catastrophic to the point of death. However, it can be. So, I mean, these are things you can really catch. It could be as simple as me saying, hey, look, I have this little thing right here. And then you forgetting to write it down and them not mentioning to the doctor. And it's like, ends up being this huge, unfortunate thing called, it's the thing that, totally blanking out at the moment, but it can basically eat your skin. And your skin, I mean, obviously then can turn into a huge infection, and depending if you're immunocompromised or if, you just aren't in good health anyway. So these are all things that we really want to pay attention to. Okay. So the reason I'm mentioning all of that has to do with the key terms. So at the beginning of each chapter, you're going to see in this nice little like bluish color key terms. So as I had mentioned, I'm going to kind of not say hint, hint, but when I mention things, please listen when I'm lecturing. This is actually going to be probably the shortest lecture. Number one is the first one. We're easing back in, la, 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 la. And it's pretty basic. So I'm just going to tell you what is important for you to know. And of course, explain it, but this is kind of I hate to say it, it's more of a memorization one, other than understanding the importance of why you need to know it. So please always look at the key terms. I think the key terms are important. I think it's important for you to know, what is alopecia? What does that mean? If you have a patient that comes in with alopecia and they don't have any hair, eyebrows, or hair on their body, and you're like, oh my God, it's cancer, it doesn't mean that the patient has cancer. And that's another part about sensitivity and understanding what's going on and what's going on with the follicles of the body, because remember, I just said hair is part of the integumentary system. So please take a look at those words, skin turgor. There are certain ones you'll know because we talk about them all the time, but then there might be some other ones that you don't know. Bruising, different types of, you'll see as you go on, but I found them to be important. So you may see them come up on a test. You may see them come up on a quiz. Just understanding those words. There's usually not very many. I did look through the chapters, But terminology, I think, is very important, not just because it does help us. You don't want to walk up to the physician or NP or another nurse and say something that doesn't sound articulate, or you don't want to document something that isn't a correct documentation, because remember, documentation is very important. And you are intelligent and you should know the words, right? Okay. So that's another part that I wanted to point out. So the skin itself, like I said, is an organ. So obviously we have an outer and an inner layer. I will want you to please take a look on page 1146 if you have I'm assuming you probably all have the newest edition of the book. So on page 1146, it does show very specifically the epidermis, the dermis, and then like the subcutaneous layer. So you know that because you give injections. So obviously, you know how deep to go for a muscular injection versus maybe a sub-Q, but it's a very good reminder. It has really good animations on it. So I really want you to take a look at it. I'm not saying I'm going to test you on it, but if I ask you, for example, you don't need to know the shaft is the exact part of the hair that extends above the skin surface. I don't care. I mean, in the big picture of things, how is that going to help me in nursing? So constantly think, how is this going to help me in my nursing career? So if I were to give, again, we're in peds. Okay, so we'll just use peds. Sorry, I think I'm getting sick. I'm negative corona, or negative corona. Yeah, negative, no, COVID, sorry. But I'm having allergies or something's going on. Maybe it's the fires, but so excuse me. So if you're going in and let's say you're going to be doing something on a 15-year-old male who's there and he wants to do volunteer work, and in order for him to do that, he has to get a tuberculin test on the forearm. And the parent might ask, or the 15-year-old might ask, what are you doing? Okay, well, I'm injecting a non-live virus into your skin. It would be nice. I mean, of course you would say skin, but I would let them know it's the very, very top of the skin, especially if they're scared of needles. That's even better. Yay, I can explain. I'm going into the very, 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 you can explain to them that, what part of the skin that actually is, which, and how deep and whatnot. And you can use whatever terminology you want, but you should know that. And just like you should know how deep you're going when you're going through the skin, when you're doing an IM, you're going into the muscle. So you have to go through all layers of the skin in order to get to the muscle. So again, it's that big picture. It's putting it together, why you're doing it, and how it's working. So all you need to do is just take a look at page 1146 and just understand that there are different layers of the skin. There's outer layers, there's, I guess you'd call them medium layers, and then there's inner layers. So just if you can do that for me, that would be great. Another thing that I thought was really important is understanding the difference of how we produce new skin, because we do produce skin a lot, right? So how often do we produce skin? How often are we shedding skin? Sounds interesting, I know. But, what does the word mitosis mean? That might be important. What does mitosis mean? What does that mean? Why does that matter? And the protein keratin, I think, is very important and is talked about actually a lot in the community. And as a healthcare professional, I think would be something very important to understand and know. So understanding the word mitosis as well as keratin. And then something that is more of like the nursing critical thinking aspect of all of this has to do with the bottom of page 1144, where it talks about where the skin, if you have skin that has basically broken. So let's say you have a patient who is in a skilled nursing facility. I don't care how old they are, but we all know, unfortunately, the older we get, usually our skin will, become thinner and it's more vulnerable to tears, and we have to be more careful. And we've all seen it. We've all talked about it. I think we understand that. But again, it's about putting it together. So why is this important? So why is it important? So another key term here is, and I'm not perfect, and you all know that I'm not good with words anyway, but stratum corneum, it affects the effective barrier. It is the effective barrier against pathogens and chemicals that basically go through the part of the, basically it's the protective barrier of your skin so that things cannot get in. So I think that would be important to know. You may not need to know the exact word, but you should know, I think, that it is important that your skin has a protective layer that will actually protect it from barriers, hopefully in a sufficient way, unless it breaks, right? So imagine, again, someone laying. It's going to break down the skin, and unfortunately pathogens are going to get in the skin, and we don't want that because what can happen? Infection. And what did we just say about the skin? The skin has many layers, and then what does it go to? The muscle. And that is not something we don't want an infection anywhere. But then if we get down to the muscle, what's underneath the muscle? The bone. So it's so important to take care of that outer part. Then, oh no, something's happening. Let's take care of the middle part and then the deepest part before we get to that. Because once we get down to that part and we get an infection in the bone or even in the skin, depending on the person, that could be something that could be very critical and life-threatening. So please keep that in mind, just as the bigger picture of nursing in general and why the skin. I mean, we all know the skin is important, but really understanding why. And in third semester, that's why I'll mention certain words here and there, but it's more about putting it together. Okay, what is melanin, or what is this, or what's that, or why does it matter? This is why it matters, and then we connect it to a story, like, oh, this person in a skilled nursing facility, right? Okay, so the words that I find important here are the key terms: mitosis, keratin, and the stratum corneum, which I'm not the best at pronouncing. And as I had just said, the bigger picture is we're always going somewhere with something, or in a lecture, it should always be going somewhere. Like, where is this going and why does it matter? Okay, am I just going to memorize this? This is not medical terminology. Where is it going? So why is it important for me to know, for example, we had just talked about this part of the skin. And right here, it talks about third-degree burns. Okay, so the loss of large portions of the stratum corneum, as with extensive third-degree burns, greatly increases the risk for infection and dehydration. So that's why it's important to understand it. That's why it's important to know. And you don't even have to ever, in my opinion, you don't have to remember that exact term, maybe for a test, but knowing that there is a particular layer of the skin that is very important, so that if you were to work in any part of a hospital, clinic, wherever you are, wherever you end up, or in the RN program or your master's program or whatever, or a family member or yourself, that we are given this part of our body to protect us from that. And we do talk about burns in chapter 55. So this is going to come back. So again, remember, I'm all about the connections, right? How are we going to make the connections? So that is a huge connection. So now you know the terms from this part that I find very important. The next one would be melanocytes, which have to do with the protein melanin. I think that you should take a special term on that. And that's because it has to do with cancer. And when you hear the word melanin and all of these terms, we tend to think of color. So different colors of the skin. And what pops in my mind, I don't know why, it's still from med-surg when I was at Mission College, is cancer. It pops in my head because I think of the melanocytes. So basically the more, cancer on that side, but melanin, which I think most people understand, has to do with if you're exposed to either like a tanning bed with like UV lights or the sun, melanin in your skin as well as your hair will lighten, basically. So that's why we have all colors and all different types of different colors, depending on, even if you're the same race, you could be a different color because you don't expose yourself to the sun as much, or it could be a genetic component, all sorts of different things. But a teaching tool there, which I would keep in mind, if you're with a patient, if you notice that they might look, it's not always pertinent that you can tell if it's maybe there's a fake tanning lotion you can use, or maybe they just happen to be a certain color and they just look tan, but that's actually the color of their skin. But there's no shame in asking. I actually remember myself, I was probably 24 22, 23. And I would use if you haven't noticed, I cover my body a lot. I like I don't like to expose my skin to the sun because I'm trying to protect it from cancer and aging, right? Because it breaks down your cells and the elastin in your skin. Many things do, smoking as well. But and the doctor actually asked me because I had I think capri pants on or something like that, and she had asked me. She's like, oh, and did some education about without even asking me first. And this is why I'm mentioning it too. Don't just assume, right? Ask your patient. Oh, I noticed that you appear tan, or you use whatever language you find comfortable with, or ask them, do you expose yourself to any sort of outdoor tanning or tanning beds? Get the information before we assume. That's always what I try to do, at least with my patients. And then it's okay to give the information. A lot of the time at age 22, 23, like, oh, I'm never going to get old or whatever. But that's our job, right? Just give them the education, information. And if they seem like potentially reluctant, or even if they don't, I would still give them proper information on wearing